Today we're actually joined with representatives of Moving with Hope, and that includes Ted Duni, who is the founder and president of Moving with Hope, and
Fred
Frank, who is a board member
Yes.
also with Moving with Hope. So first of all, gentlemen, thank you very much for allowing us to bring our cameras to your facility.
Thank you, Marc.
We're here at 415 Howe Avenue, which is at the intersection of West Canal and Center Street, right across from Dunkin' Donuts. And maybe we'll start with you, Tad. Just if you could tell a little bit about exactly what is Moving with Hope and how did it come about?
Moving with Hope was founded in 2010. It's a 501c3 charity. The purpose of the nonprofit really is to provide funding for people with special needs, disability, and chronic illness that need complicated after therapy when they've been booted out of traditional PT because of their affect or inability to move fast enough to be engaged in PT within that half-hour window. So they come to us and receive excellent care through the hard work of Moving with Hope.
Excellent, excellent. How long has Moving with Hope been in existence?
4 years, again, 2010, February, and we're proud to be able to continue the mission through a great number of programs that we're running, gift shops, programs for the general public, which we'll talk about later in the program. And that's really about
That's
it, Marc.
good. Okay,
Thank
so
you.
Specifically, what sort of services do you offer? So what I guess what it sounds like is somebody is going through PT, maybe rehab from having been in the hospital, perhaps, or an
skilled nursing facility, outpatient physical therapy, or they've basically just been homebound. They've been homebound, and they've really fallen away from any physical therapy at all unless they have an incident. In other words, if they've had a fall and they re-enter the hospital for 3 days, they trigger a benefit of physical therapy.
Okay.
But unless there's been an incident, there's no reason for them to go into physical therapy. And if you're homebound in a wheelchair, it's unlikely you're going to fall.
Oh, yeah.
You're going to become more and more mobile. You're going to become less fit. More, in many cases, I can't say all cases, but in many cases, isolated and depressed. You're not going to be able to get out into your community, engage with your friends and family. So we act as a mechanism to get people out of their homes.
That's great. That's great. So if someone is homebound to that point, how does it start? In other words, if there is no incident, is there any way does Moving with Hope actually proactively try to seek out potential patients, or is it always sort of something happens and it's more of a reaction, okay, now we have to do something?
Well, essentially what happens is people find out about Life Design's Rehabilitation Center in downtown Shelton, which is the center where the tiered rehabilitation takes place, and they're unable to afford the services that Life Designs offers. So then there is a scholarship program created through Moving with Hope.
Oh, okay.
And the scholarship program is then able to fund the programming, in some cases the transportation to get to Life Designs Rehabilitation Center.
Okay.
The programs run between $3,000 and in some cases $12,000 a year. We had a young man who had a diving accident a year and a half ago and partially fractured C4, C5. He was partially paralyzed, full paralyzed for 2 months, and then his right toe and his right hand started to move a little bit. And we met him really through a small ad in a local paper that one of the physical therapists he was working with saw and said, basically handed the ad to the mom.
Right.
She called me up immediately, or called us up immediately, and before you know it, he was down here in our new overhead rail system, and we were able to, for the first time since his accident, take him out of his wheelchair and have him weight bear, and have him start walking by basically guiding his feet for the first time since his accident. This would have been April of 2012. He had his accident in August of 2011. So we really were the catalyst to get him actually to qualify for one of the greatest programs in the world at the Shepherd Center in Georgia.
Okay.
But because he was able to actually stand and start to ambulate and move his hands and feet, he became a candidate to go 6 months, 7 days a week in this very aggressive therapy program.
Wow.
So we really allowed that to happen. We're very proud of that.
I mean, that's impressive unto itself to know that if someone is here you are actually coordinating with something that's not necessarily even in Connecticut. I mean, you're actually getting them, if there's a, let's say, I mean, I think of New York City, but that's, that's available right here, but you're talking about, Georgia.
Yeah.
That's great. I mean, that's, because then your resources aren't necessarily limited to Connecticut or even the Valley.
You're trying to get people through the next step.
That's good. So you said that they come here, they were doing some physical rehabilitation. Mm-hmm. So the people who work here, what sort of criteria or qualifications do they have to actually perform that?
Well, that's the other unique aspect of what the relationship between Moving Hope and Life Designs Rehabilitation Center. Life Designs Rehabilitation Center is a cash program, and therefore doesn't have all the restraints and all the red tape of a licensed physical therapy center. Mm-hmm. The licensed physical therapy center is wonderful. They can do very, very aggressive things very early on after an acute injury, a stroke, a brain injury, spinal cord injury, people that have an exacerbation of MS or some problem with dementia or whatever, with Parkinson's. We don't attempt to do that. What we attempt to do is increase their mobility.
Okay.
And basically that can be done by a person like myself who is credentialed. I mean, I have a master's degree in applied physiology and movement science from Columbia University, 30 years of experience in the movement business. But the aides and techs that work with me, I train them to do just specifically what I want them to do. I don't want them to do physical therapy. I don't want them to do things that are out of the realm of our ability as a company.
Okay.
And the key thing is the client sometimes needs to stay here 5, 6, 7 hours a day. Well, maybe not 7, but 6 certainly. So then that process is what the nonprofit funds, because that whole day provides wonderful benefit to that person. They can have repeated bouts of activity. So when you come in here very frail, haven't maybe been out of a wheelchair or out of a bed in a year, you're not able to even sit without flopping over. Mm-hmm. You're not going to get very good results in a 30-visit annual window, which is what a benefit is for PT. You're going to get 30 half-hour visits, maybe 40 minutes if you're lucky, under the Medicare laws. When you're younger, orthopedic physical therapists will give you up to an hour. But when you're under Medicare and Medicaid, you're basically going to get 20 minutes to a half an hour.
Okay.
Because you're getting 70 cents on the dollar.
Okay.
And what we can do is we can do 6 half-hour bouts. Take a break for lunch. Take a nap. Go across the street to Dunkin' Donuts. Socialize with your community. Go to the bank. Go out to the wheel walk or the river walk or the organic farmers market.
Right.
You can do things throughout that day that enrich your life beyond the mobility reasons for being here, and that is a very valuable service.
Sure, absolutely.
And that's what the nonprofit does. The nonprofit provides the socialization, the recreation, the inclusion, and Life Designs Rehabilitation Center offers the after therapy services to the client, and it's a great blend of a full day of activity.
Sounds really good. Now, the tech and the aides, what are their? Are they trained physical therapists? Is it just based on training when they come here?
Just based on training when they come here.
Okay.
They're basically getting. They have to shadow me for 2 or 3 weeks. They have to learn how to read my nomenclature, how I'm writing, how I'm describing, basically a range of motion and what they need to do or what they cannot do with a client. Mm-hmm. And then after they've shadowed with me, I do all the work with the person initially for the first week to 3 weeks. Then basically we push people away into small groups where I'll be working with a person individually, and then I'll keep my eye on 3 or 4 people with 2 techs, or maybe we'll just have people that are more complicated neurologically, or they have endocrine issues, or their orthopedic tolerance is poor. I'll have them come for the first 2 or 3 weeks on off days.
Oh, okay.
So they come on off days when it's quiet, and then eventually when they learn some of their routine or when they're a little bit more independent, we can push them back to a Monday, Wednesday, Friday, or maybe a Monday, Wednesday, Saturday.
Right.
And the idea is eventually a tech will be working with 3 or 4 people at a time. We'll have 2 techs. I'll be working with 2 or 3 people. So we can see probably about 10 to 12 people an hour in that format.
Now, you mentioned the masters from Columbia that you have. Do you have any physical therapy training other than that, or in addition to that?
The master's degree in movement science is when you complete a master's in movement science from Columbia University, you have the same technical background as a physical therapist.
Right.
Most of my fellow students were physical therapists.
Oh, okay.
Or they were getting their doctorate in doing research on movement disorders,
like kinesiology and things like that.
Cerebral palsy,
Right.
MS. They're to this day that department is doing some groundbreaking work on robotics.
Oh, wow, really?
In terms of helping people who are less mobile move effectively, doing gait training studies and mobility studies.
Okay.
But the idea is after therapy is after therapy.
Right.
They have completed all of their physical therapy. The discharge nurse or case manager has essentially said, your gains at this point in time are slow or none. You're discharged.
Okay.
The family or the individual disagrees with that definition, and they seek me out through church. I have ads out there.
Sure. And a website.
Right. The key is, how do you afford to come here? Because I'm really not here to promote Life Designs Rehabilitation Center. I'm here to promote Moving with Hope. There has to be a funding mechanism to help people come to facilities like Life Designs, and unfortunately there are really none elsewhere in Connecticut, but there should be. And the funding mechanism really are the programs we offer, such as the youth exercise programs, the adult exercise programs for all people, not people with disabilities. So Moving with Hope has weight management programs, it has exercise programs, it has a gift shop, and the net proceeds from those programs are the form of create scholarship.
Oh, that's interesting.
We have annual appeals. We get grants from the Valley Community Foundation. We get grants from small businesses. We just got a $200 grant from local 210 Carpenters Union out of Fairfield. So that money is given to people who need scholarship. This summer, we're kind of going off our mission statement a little bit, and we're doing the exact same thing for children with special needs.
Oh, okay.
So in conjunction with the Shelton High School, Shelton Youth Services, the Valley Community Foundation, and the City Hall of Shelton, we're going to get grants to provide hopefully $3,000 or $4,000 of free programming to kids at risk.
Wow.
Kids that have special needs, kids that have disabilities, kids that have families that are struggling financially, and they'll be able to use our programs upstairs at Willie's Field for virtually nothing throughout the entire summer. And then the parents will be down here once a week for 8 weeks. Not all the parents, because not all the parents are going to buy into it. And we're going to have an amazing healthy nutrition program, again, targeting obesity, diabetes in children and adults. And many of those family members are going to be hand-picked by individuals in the Shelton Youth Services Department in conjunction with the Boys and Girls Club. They're on board with the same program.
Oh, good.
So it's going to be a neat program. And again, all the proceeds from that are taken and then help people with chronic illness and disability come to Life Designs Rehabilitation Center so they can basically augment or continue their recovery.
So many of those programs you mentioned aren't necessarily for people who have disabilities.
Absolutely.
You offer sort of all these services almost like a nonprofit sports center, nonprofit athletic center, and then use the profits from those, or I guess the funding from that, to then provide the rest of the business. That's a really good idea. I don't know if you're familiar with the Vitals program that's going on in the Valley. It's
somewhat. I know it's in conjunction with Griffin Hospital.
Correct, and a lot of the superintendents and the schools, and it's basically an anti-obesity program, which is what made me think of it. And in this case, they're not only doing things to get kids more active, get up out of their chair, not just recess, but during class, move around, but then also working with the food service people so that you teach kids about eating healthy and fruits and vegetables, things like that. But then they may go to the cafeteria and it flies in the face of what they've just been taught. They've got the companies that are running the cafeterias involved. And school psychologists, guidance counselors. I believe the athletic director over at Shelton High School is spearheading things like that. So I think all of that, it's like any facet of a child's life that could affect their ability to stay healthy.
Yeah. In reading that data, the interesting thing I like about what we're doing that can really supplement that is we're targeting the parents.
Oh, okay.
So that the kids are hearing this from the Shelton school system or the Derby school system, all good stuff, good. But when they go home, mom's tired, dad's tired, and it's a conflict.
Absolutely.
So the idea is to have this convergence of knowledge, so that what the kids are hearing at school is implemented at home, because the parents are learning essentially the exact same data. I mean, the program that we use is a nationally recognized evidence-based program. It's been around for 20 years. It's a manual. You follow it, you learn.
Okay.
You know, you go through 14 weeks. We're just going to do segments of it in the summer. You're going to learn what it takes to have your family, one bite at a time, is their little trademark, eat healthier and become more physically active.
So is that more of a classroom environment?
Yeah, for the parents. They'll be right in here.
But then you also offer those where kids are actually active doing things like that. Okay, good.
So we're really, and the more, I mean, you couldn't have enough of what the Vitals program is doing.
Absolutely.
You can't have enough.
Totally agree.
Because we have, for every dollar we spend on staffing, knowledge, and advertising, our true competitors, which are the fast food joints and the box stores that sell unhealthy food, they have $50 to $100. So the ratio is just outrageous. So
right, and that reminds me too. The other thing, the supermarkets are involved. You know, they're coming up with that new Val score, where you will see just a 1 to 100 how nutritionally value something is overall, as opposed to having, you know, theoretically reading the whole label. And all Big Y, Stop and Shop, and Stop and Shop Right, all in the Valley, all active. So it's nice because and they're obviously, you know, not just located here. So you've got sort of a corporate involvement from far away, but then also a local community. And to your point, you mentioned Moving with Hope is the only thing really like it in Connecticut. Only type. Same thing with the Vitals program. The Vitals program, I believe, is being prototyped here to then be used in other regions in Connecticut.
I'm attempting to do the same thing. We have Jim Himes is coming to our office next week. I hope to meet with Nancy Weissman in a couple of weeks at Capitol Hill. Again, great. Just basically putting out the proposal that, you know, this is something that can be implemented rather quickly and easily if we just get other organizations that already exist on board. So you don't have to reinvent the wheel. You can go to the Ys. There's 30 or 40 Ys in Connecticut.
Right.
Okay. I've been talking with the Y director in the Valley. He seems very interested, but you know, everything's got to move slowly. There's boys and girls clubs. Every town has a community center. They all can start implementing these programs, because in the Valley alone, there's 25,000 people that could be coming down here.
Absolutely.
Yeah,
Absolutely.
how can I see 25,000 people? I can maybe see 200 people a year.
Right.
So if we could see 5% of those 25,000 people between 7 centers in the Valley, we would make a cultural change.
Right, or similar to the Boys Club, you start out in Shelton, maybe then you have one in Ansonia or Oxford. You could create satellite areas,
you can.
Assuming the demand is there.
Yeah, the capital cost would be extraordinary.
Right,
that's why it would be better to take existing places.
Exactly. Right.
I mean, you got Shelton Community Center. They've already invested $7 million in that building. Take a segment of the community center and do it there.
And a lot of the Parks and Rec programs are probably somewhat similar, especially for the kids. That's a good point.
So you just you partner. Piggyback on what other people
really good.
And the capital it's already invested doesn't have to be reinvested again, because there's no money left.
Right. That's right.
The money's all gone.
Now, as far as speaking of money, as far as people who, going back to the people who are disabled coming here for their rehab or their, I understand that many of them, or maybe all of them, are on some sort of like Social Security disability, or
I would say about a third.
Okay.
Some of them are on Social Security and disability, but because they worked until they were 50 to 60,
right?
They have long-term disability policies. They have savings. They're doing okay.
Right, right.
They still get their SSDI. They're not making the money they were making when they were in the corporate world, but they can pay almost the retail value of the program.
Okay, okay.
And then there are some people like Joe I was talking to you about,
right,
who is probably in the $800 to $900 a month range, and his direct cost, because everybody's got to pay, is $30 a month. So you got somebody paying $30 a month and somebody paying $700 a month, and the people that can pay $700 a month pay it because they see the value in it and they can pay it.
Right, right.
Or they've done their own fundraising,
right,
through family. I can tell you all kinds of stories of people that really love what we do here, and they've done their own fundraising and then have those proceeds given to the nonprofit. And so there's this huge range of what people can afford to pay, and the key really is no one should be turned away if there is a need. It's my opinion.
That's good.
Really, no one should be turned away, and unfortunately, we still have to turn people away because Moving with Hope is still young.
Sure, and I would, from what you told me, it sounds like it's all contingent on how those other programs do and how that money can be allocated, things like that.
And and obviously, we're hopefully Looking forward to being a United Way agency this year. You have to kind of be in existence for 3 or 4 years before you can kind of be on that
I'm glad
level.
you mentioned that, because when you mentioned all those other organizations or the Community Foundation, I was waiting to hear United
'cause
Way, so I'm glad that
we're on the Valley Health Council.
Oh, good.
And we're involved with the Valley United Way, but we have yet to be made an agency. And I'm hoping that Jack and his group,
Right.
because we do have lots of clients that come here, that in their direct giving they would point it toward us if we were an
Sure.
agency.
I mean, a lot of Jack was on our show with Joe Pagliaro, and they talked about all the youth leadership programs and all the kid-oriented programs. So I could definitely see sort of a synergy between what you're doing, for kids especially, but not just them, and what the United Way already does. As opposed, on more of a like I said, a teamwork leadership that isn't necessarily geared towards activity per se, but then you tie it in with Moving with Hope, and you can do that. Have any comments on the show? Feel free to provide feedback, questions, or suggestions to lookingupvalley@gmail.com, or check out our Facebook page and dedicated website. Thank you very much.